This is where Britain's youngest person with coronavirus died yesterday. 13-year-old Ismail Mohamed Abdulwahab from Brixton was being treated at King's College Hospital in London. His family were unable to visit him, and friends are tonight paying tribute. He was a bubble of life that you would meet and smile, says one, falling in love with him immediately. His love was pure and everyone around him loved him. He was a source of life for the whole family. Hundreds of other families have also been torn apart by this deadly disease, an invisible killer leaving scars of grief that will be seen and felt for generations. Christopher and Isabel Vallely, married for just over 53 years, raised 3 children. They died in the same hospital in Belfast, in the same room, 12 hours apart.
We still can't believe it, we got the phone call about mum, and then within hours we got the phone call about dad.
Fiona Vallely and her family are trying to cope with the deaths of both her parents within a single day.
You don't realise, we've seen, firsthand what this can do to a family, and to both our parents.
The loss now even greater, with the largest day-on-day rise in the number of deaths since the outbreak began.
The increase in the number of deaths is deeply shocking, disturbing, moving. And that's one of the reasons why it's so important that people maintain the social distancing measures in order to improve and increase the resilience of the NHS and to slow the spread of the disease.
But the number of COVID cases appears to have reached a plateau, perhaps a glimmer of hope.
Maybe some green shoots, but the last thing I would want is a message to anybody that this is a time to take our foot off the pedal.
Among those who've died, 108-year-old Hilda Churchill lived through 2 world wars and the 1918 Spanish flu outbreak, the world's deadliest pandemic. Her family says she'll be much missed.
And I was explaining to her how there was cancelling flights and things like that to help prevent the spread of it. And then she referred back to the Spanish flu, saying, well, we didn't have planes back then, but it's still carried over from country to country. She said it's just difficult to believe how something you can't see can be so devastating to the human race.
Behind every single statistic, more families now in mourning.
And Emily is, of course, here to talk about all this. Maybe we should begin. What more do you know about this unbelievably tragic case of this poor 13-year-old boy?
Yeah, it is tragic, isn't it? Truly tragic, and he's quite obviously the youngest victim in the UK. He was being treated at King's College Hospital in London, as I said in my report. I understand that he had no underlying health conditions. I also understand that he was rushed to hospital on Thursday last week. He was put on a ventilator and then it's reported put into a coma. And I understand that he died of a cardiac arrest yesterday. Obviously, his family are devastated. They weren't able to be with him when he died. And I think tonight that the age of this boy is probably going to shock a lot of people in this country tonight.
Well, it's not just this poor 13-year-old. A 19-year-old also died. As I understand it, didn't have any underlying health conditions. Now, as I understand it, that doesn't change the overall picture that, by and large, the people dying are more elderly. Not that that makes anything any better, but at least people thought, well, our kids are safe. But what pattern is there, if anything, that you can see?
There isn't a pattern. The only pattern is that the elderly and people with underlying health conditions do seem to be more at risk, because the majority of deaths are in older people and people with underlying health conditions. But the truth is, it appears to be affecting different ages and different people in different ways. So some are getting very mild symptoms, some get very severe symptoms. Imperial College scientists did some modelling and they predicted that 0.03% of people under 30 in this country would die. Now, obviously, that is very rare, but it means you double it and double it and double it. Lots of people will die. Lots of people will, young people will die. Now, older people are typically more at risk because their immune system is not so robust. Overwhelmingly, the statistics show that those who need critical care are in their 80s. 70% of those needing critical care are in their 80s, around 40% in their 70s. It goes down to about 20% who are under 40. And it does feel like there's been a spate of younger deaths, doesn't there? But really, we just don't know. And we won't know until more is known about this virus in the months and the years to come.
OK, this is grim stuff, Emily. Thank you. Speak tomorrow, no doubt.